Hello and welcome to 911ready.org, where we're going to look at the best 911 partner. But first, I have a few questions. When you call 911 for help, have you ever thought about how we contribute to the success of the emergency call? Or have you wondered how emergency medical personnel know your medical background when you're unconscious and cannot speak for yourself? How do they do that? You might be surprised to learn that we, the public, could be the reason that an emergency responder is delayed, not necessarily them. Lastly, if you're alone and become sick or injured and call 911 for help, how do the responders enter your home when the doors are locked? How does that happen? Answers to these and many more questions will be explained. So if you're ready, let's get rolling. We're going to learn who is the best 911 partner. My name is Lee Height. Before we begin, I want to mention as a layperson involved in the emergency service industry, it was a culture shock for me to see the conditions under which these responders were expected to do their job. In a normal place of business, the issues I'm going to talk about here would be fixed, and they would be fixed quickly. However, they're not so easy to fix in the emergency services industry. Turns out it's going to be up to us. Also, as a disclaimer, I want to make it clear that I am not speaking on behalf of any emergency response agency. I've never been a firefighter, EMT, paramedic, or police officer, and I certainly am not a doctor. These are my observations over 28 years of volunteering for these organizations, and these are my recommendations. By the way, everything in the presentation is on the website, 911ready.org, so if you miss part of the presentation or don't understand something, please check with the website. And as a handy reference, you can download this checklist and use it as a guide to go through the process of becoming the best 911 partner. You may not have thought about this much, but as I mentioned, we all can become partners with the 911 system. We are the ones responders train countless hours on how to provide excellent service. I can say firsthand, they take their job very seriously and sincerely want to provide the best service possible. In addition, I want to mention that pre-COVID, I happened to do some training at our local career center where high school students are preparing for a career as a firefighter EMT. I was surprised to learn students were being hired before they even graduated from high school as part-time help at the local fire department. Of course, they continued their education and graduated and passed all certifications before they were hired full-time. But hiring full-time right out of high school was not done before. This is an extreme shortage. To understand the setting for this presentation, I would like you to consider what it's like to be a responder. Obviously, when we call 911, we're asking for help. We have an emergency of some sort. So the call taker collects the information and they take it from there. For the purposes of this training, I consider that call somewhat like tossing the need for help over the wall and hoping for the best. Well, we will receive the best they can offer under the circumstances we provide. However, we are probably not aware that we could cause delay in the response, sometimes a serious delay for a medical, fire, or law enforcement issue. Of course, we want the response to be perfect. We want a fast response that has the best possible outcome. So what follows are simple tasks we, the public, can do to facilitate an optimum outcome. To achieve our goal, I suggest we move that 911 call off to the side and first become a partner in the emergency response. We can do that with good planning and become the best 911 partner. As we begin, I am sure many of you are already aware of how the brain responds in an emergency. In a high trauma situation, it's perfectly normal for the body to produce a surge of adrenaline that can result in something called the adrenaline blockage and prevents the brain from functioning normally. Professionals train and learn to overcome this blockage. However, we, the public, often experience an adrenaline blockage during a high trauma emergency, and often we cannot answer simple questions. I'll give you this one example. The medical crew had responded to a call for a patient with a possible heart attack. Upon arrival, the patient had no respiration and no pulse. Paramedics revived the patient, but it was important to get him to a level 1 trauma center at the hospital as soon as possible. The medics were quite busy, so consequently, I was taking the medical report. Because of difficulty finding their address, we were uncertain about the accurate address. So I asked the wife about her address. She looked me straight in the eye, pointed her finger at me, and said, "I have an address. I don't know what it is." I said, "No problem. I'll get it from an envelope in the mailbox," and on we went. So the following is intended to answer questions and have prepared answers before the emergency crew arrives. So we do not have to think about the correct answer. So let's begin with the largest issue facing an emergency responder. What is your emergency has been the typical response when you call 911. Now, because of poor address signage and the uncertainty in location caused by cell phones, call takers are first asking for the address of your emergency, then an explanation of why you're calling. Unfortunately, most of us don't think about our address in terms of emergency services quickly locating us. To gain an appreciation for responding and locating an address, let's imagine you are driving the ambulance today. You've received a call for service on Misty Creek Drive. So let's get in the vehicle and get going. Here's the subdivision that you're responding to. The red arrow indicates your destination address, and so far it looks fairly straightforward. When you enter the emergency vehicle, the responder will typically use a mapping system specific to their jurisdiction or perhaps a GPS system. Responders are really no different than you or I. Some prefer a map and others prefer written instructions. Here we're looking at both, written instructions on the left-hand side and a map with the arrow on the right-hand side, pointing to Misty Creek Drive. As you enter the subdivision, the mapping system will do a good job guiding the vehicle to its destination street. As you can see, the vehicle has approached Misty Creek Drive, and here you'll experience your first uncertainty. Any idea what you're going to be faced with here? As you turn on Misty Creek Drive, the first thing you notice is only 50% of the addresses are visible because they're not on both sides of the mailbox. The Postal Service only requires numbers on the carrier's arrival side of the mailbox. You are responding to an address on the left-hand side of the street, and here are the mailboxes you see. The mailbox on the right-hand side, of course, has excellent addressing with 3-inch high white reflective numbers on a dark background. Most likely you will drive by the address until you can look back and see the numbers on the other side of the mailbox, if they're there at all. You might say, well, just simply back up. What's the problem? Well, typically an emergency vehicle cannot back up without someone being behind the vehicle to assure a safe and clear passage. The driver does have a backup camera and can see directly behind the vehicle. However, kids of all ages are curious about sirens and lights and often come running into the street to see what's going on. Positioning a person behind the vehicle can easily see someone about to run behind the vehicle. And again, all of this takes additional time. You might also say, well, if you cannot back up, just pull in the driveway and turn around. The weight of the vehicles can easily damage your driveway, and typically the driver will go to the end of the street where they can find a safe turnaround. Again, all of this wasting precious time. So, what do responders want to see? What is perfect addressing? The preferred signage is white reflective letters on a dark background, as shown here. You probably recognize these signs as 911 signs. The numbers are on both sides, allowing for good visibility from either direction of travel. This is the same standard used by the Highway Department, white reflective letters on a dark background. You can easily add numbers to both sides of your mailbox. Here are some examples from Home Depot, Lowe's, Walmart, Menards, and yes, you can get them all from Amazon. Here are examples of good signage. This mailbox uses 3-inch high white reflective numbers, and you can see it has excellent visibility at nighttime. Another approach uses 5-inch high numbers on a post that is roadside, also with good nighttime visibility. It may surprise you, but good addressing does not recommend the use of black letters on a white reflective background. The reason is very simple. What color does not show up at night? Black or white? While black on white is easy to see in the daytime, the excessive amount of light from the reflective background can bleed into the black numbers from the high intensity lights on the emergency vehicle as shown here, particularly if the black is somewhat faded. Also, you may have noticed this yourself, but we highly discourage the use of brass lettering. Not only does it hide the daytime, but it's absolutely impossible to see at night. So we do not recommend black or brass numbers. Here we're looking at a somewhat unusual but common situation. This home is located at the corner of two streets. The home faces Briar Cove, which is the legal address for the home. However, the mailbox is located on Sweetbriar and causes considerable confusion for those attempting to locate this address. Therefore, if your mailbox is on a different street from your house or apartment address, please place your full street name and address on the mailbox. In this neighborhood, the builder used brass for the mailbox numbers, which we know hides daytime and nighttime. In addition, they placed numbers on the home that were well lit, but they were painted gray. While they were visible daytime, it was impossible to see these at night. So the solution was to change the color to pure white, which easily made them visible from the street at nighttime. If you live in an area that uses community mailboxes rather than individual mailboxes, it's important to display your address on your house using a minimum of 4 or 5 inch high numbers that are well illuminated and have a high contrast to the background, both daytime and nighttime. As you can see, this address has house numbers, but they're hidden by vegetation. So, as an alternate, place a small post with the address visible from both sides located near the roadside. Here's a condition that exists all over the country. As emergency vehicles enter the cul-de-sac, they want to see the address without having to drive around and look at each individual mailbox. So for these 3 homes, we recommend adding a sign that faces directly down the street to be visible as the emergency vehicle approaches. Some HOAs require mailboxes to be on the same side of the street as shown here, which adds uncertainty as to which side of the street your home is on. We recommend you use a directional arrow on the mailbox if you share a driveway or if the mailboxes are all on the same side of the road. What are we looking at here? A foreign language? Yes. Avoid using cursive language for address signage because it's nowadays a foreign language to many young people. I have a granddaughter age 23 graduating in education, and she cannot read or write cursive language. It was no longer taught in her school. They did teach them how to print, but no cursive. So it's likely young people entering the emergency services profession will also not recognize cursive language. In addition, it does take longer for the brain to accurately process cursive numbers than printed numbers. Do not rely on curbside painted numbers. Responders cannot see them as they approach from down the road. The numbers are easily faded, covered by snow, dirt, and debris, and completely hidden by a parked car. Responders ask that you display your address on your house to remove uncertainty using a minimum of 4 or 5 inch high numbers and make sure they're visible from the street and brightly illuminated. Occasionally, a mailbox may not be located directly in front of your home. So in those situations, place a post with a sign visible from both directions at the front of your property in front of your home. Also, responders will typically look for the address at the entrance door to the facility. So best to locate it there as opposed to somewhere else on the building. If you live on a street where the emergency vehicle will decide to turn left or right on their way to your home, it's a good idea to remove uncertainty by having address ranges with directional arrows included with the street name as shown here. By the way, something I often hear from people with no address signage or poor address signage goes something like this. Well, I don't have to worry about my address signage because EMS was here last week. They found me, no problem. So I don't really have to concern myself with this. My response to them has been, that driver may have been a seasoned responder who has been down that road many, many times. But tomorrow you could have a new employee that has never traveled this road before. Then if they drive by, how much delay will occur? Let's transition into the next issue that can cause significant delay in processing the emergency scene. I'm sure you're aware there are numerous medical conditions where the response time can affect the outcome, and here are just a few. According to the American Heart Association, when someone collapses with no heartbeat and no respiration, CPR with the use of an AED should begin immediately. You may know how to perform CPR, but it's likely an AED may not exist and will only arrive on the emergency vehicle. Obviously, response time is critical. It's no surprise that severe bleeding is a time-sensitive condition and can quickly lead to a fatality, so consequently, an immediate response is required. If you do not already own and know how to use the modern-day tourniquet, I highly recommend acquiring that skill. It's effective and easy to use, but you should have some training. You may be aware of training called Stop the Bleed, typically taught by the local fire departments. I highly recommend becoming skilled at this procedure. If there's no intervention by the time help arrives, it could be too late. Shock is another time-sensitive condition. It can be difficult to diagnose and often goes unnoticed because there are very few symptoms. There are many causes as shown here, and the condition can quickly escalate into a serious condition. Here's a question often asked of responders. After you call 911 for a medical condition, you would naturally expect an ambulance to arrive. However, they may not be the first emergency vehicle on the scene. Most often, it could be a police officer because they're already out in their jurisdiction and likely to be closer to you than the ambulance. In some jurisdictions, a police officer will have an AED on board and can administer CPR with an AED. There are many examples where a police officer has saved more lives than the ambulance simply because they're nearby. Eventually, the ambulance will arrive, but it's possible a fire truck may be the first vehicle on the scene. Why the fire truck? As I'm sure you know, in most fire departments, the personnel nowadays are cross-trained as firefighter, EMT, paramedics. Typically, the fire truck will contain most of the medical equipment contained on the ambulance. The only difference is the fire truck cannot transport patients. When the ambulance does arrive, many people expect the patient to be quickly loaded onto the gurney and rushed off to the hospital. But that may not be the case. Why is that? Instead of load and go, as they say, which may be required for some circumstances, the preferred method is to use the on-site technology, diagnose and stabilize the patient. Reducing an emergency down to a lesser level is better for everyone involved. On occasion, the patient may be moved from the facility into the ambulance, but then they just sit there. Why? Why don't they get going? Did the patient die? Is a question I often hear. No, it's because it can be safer and a better environment to stabilize the patient than inside the facility. Once stabilized, then off they go. Then transport the patient with a slow, easy ride to the hospital. This makes it more comfortable, causes less tension and stress for the patient and everyone involved. As you know, when you visit your doctor or dentist these days, they will not see you until you've completed or updated your medical history with accurate information. However, in a medical situation, we often expect the responding medics to treat the patient without knowing much about their medical background. When a player becomes unconscious on the sports field or the golf course, do the teammates know the accurate medical background? If the response is inside your home or business and you become unconscious, who knows your accurate medical history? I can safely say that all emergency medical services personnel highly recommend that you have a readily available and updated emergency medical data sheet for handoff to the medics. Having accurate and up-to-date history can significantly enhance the level of care. When many modern ambulances arrive at the emergency room, they often make a secure wireless connection with the hospital and hand off the emergency report before the ambulance ever comes to a stop. This allows emergency room personnel and nurses to begin to prepare for the patient's arrival. Having adequate and accurate medical information about the patient can greatly enhance the speed of care through the emergency room. As you are processed through the medical system, this information follows you. Not only are you handed off to the emergency room, but you quickly can be handed off to the operating room, CAT scan, MRI, X-ray, and sometimes even another hospital. On the website, you can download this emergency medical data sheet. It is a form fill sheet that you can complete using your computer and then save it to a file on your computer. This makes it easy to update information without having to redo the entire sheet. Simply update the sheet, save it, and print new copies. After you complete the sheet, fold it to the dotted line, leaving the words emergency medical data visible. Also, try not to leave questions unanswered. If the answer is no, please say no, so they know you did not overlook that question. In this example, if the patient cannot speak and has no speech impairment, then an injury might be involved. Also, try to answer all questions. For example, why do they need to know your eye color? On scene, they're doing what is called rapid assessment, and in a trauma situation to the head, the eyes can change color. The medics will not know your normal color unless you tell them ahead of time in the emergency medical data sheet. Also, again, please print and use the online form document. Do not use cursive. I highly encourage the use of the computer and fill it out to be more legible and easily updated when information changes. Moving down the form are categories for allergies and medications. Please include the name of the drug, the dosage, and the frequency that you take the medication. Additional categories are included for surgeries, recent injuries, overall health conditions, vaccinations, and health insurance. Date the form when it was completed and keep it up to date when medications or other information changes. Also, not all of this information may be needed in the emergency room. As you travel through the medical diagnosis and treatment process, many questions come up that may be answered on this data sheet. By the way, a side benefit for this sheet is when you visit your doctor for a routine visit and they ask you to update your information, it's handy to take this sheet with you. When you're completing their forms, the paperwork is a good reference with accurate data. My wife and I do this all the time. It's really handy. Once you have completed the medical data sheet, where do you place it? The most common appliance in any facility, home or business, is the refrigerator. It's recommended that you attach the medical data sheet to the front side of your refrigerator using magnets. On some stainless steel refrigerators, a magnet will not work, and you may need to use a stick-on clip. The American Red Cross provides a sealed plastic container for storing the medical data sheet, and they suggest placing it in the door of the refrigerator on the top shelf. You want to make it as easily accessible as possible. Some departments have their own envelope for you to store the medical data sheet on the refrigerator, and others have a variety of storage containers. Check with your local fire department if they have a preference about location. So here's the question. We recommend making the data sheet accessible, but is the sheet private? Yes, the information on the sheet is private, but not its location. Tell your friends and family that you have an emergency medical data sheet and its location. In addition, it's okay to know what medications your spouse and other family members are taking. I say that because the paramedics were in the bedroom trying to revive the wife, and I asked her husband what medications she had been prescribed, because the medics needed to know what she was currently taking before they could administer a necessary drug. He loudly proclaimed, "That is private information," and he would never ask her what medication she was taking. Consequently, I had to wait for him to boot up the computer, find the files where she kept the medication list, and get the printer working. We easily lost 4 to 5 minutes in that process, and she was not doing well, but she did survive. I have noticed people living alone, particularly seniors, want to assure that the emergency medical data sheet is readily available. So they often place it in an envelope on the table in the foyer where the medics will arrive, and then they tell the 911 call taker its location. Additional locations should be a copy in the glove box for each of your vehicles. Some prefer over the visor, but the glove box is the most common location responders will look. Other suggested locations include your golf bag, billfold, backpack, baby pack, and yes, your walker. You want the information available and accessible anywhere you might be. So when you print out new copies, print several, one for each of these locations. I do want to mention that some departments provide a USB drive for storage of your medical information. For the most part, they are safe to use. However, there is a risk. The drive may not be virus-free because, as you know, there are malicious people providing what is called a killer USB drive that will immediately crash your computer when you insert it into the computer. While many of these are safe to use, my personal choice was never to use a USB drive from the patient. We could not take the risk of destroying the unseen computer. You may already be aware of this, but I want to mention that a lost USB drive could represent an opportunity for identity theft. While identity theft can lead to financial losses, it can be a much larger loss when you lose your medical identity. I want to particularly draw attention to the Social Security number for young children. Reports indicate that financial losses for a stolen child's Social Security number is considerably more than adults, and often goes unnoticed for many, many years because no one is checking on the child's Social Security number. So if you have young children in your life, have someone check on their Social Security number. Moving on, here's a simple action we can take to minimize delays and remove doubt and uncertainty as to your exact location. When an emergency vehicle is proceeding down a street like this, your address may be difficult to locate because of trees, parked cars, and trucks. After you call 911, start assigning tasks to bystanders. Ask someone to stand in the road, wave their arms at the ambulance, or if it's at nighttime, flash the front porch light, or shine a flashlight toward the ambulance. Also ask someone to clear snow from the sidewalk, clear a path to the patient's location so medics can have an unrestricted access. So be obvious, remove the doubt, this is not a time to be bashful. In addition to flipping the porch light off and on, you can purchase a special electrical switch that will do this for you, and it's called the 911 switch. This will automatically flash the front porch light when activated. The switch looks something like this and will function as a normal on and off switch for the porch light. It comes with a small remote used to activate the flashing light that you can use when you call 911. For the record, I have no connection with this company. I just think it's a good idea. I have a front porch light that flashes. Moving on, let's deal with how to access your emergency. When you call for help but are unable to get to a locked door, how are emergency personnel going to access your facility? Many of us will have a spare key hidden somewhere outside when we're locked out, but do the responders know about this? Others may provide a spare key to one or more of their neighbors, but again, do the responders know about it? So if they don't know about your spare key or an alternate method of accessing your facility, they may do a forced entry. They have an impressive set of entry tools, and they train often on the least invasive method of entering a locked facility. No one wants to cause damage to your property, but there are times when it's unavoidable. By the way, before the 911 system came into existence in 1968, calls for medical and fire were received by your local fire department. Even then, they had the ability to know about your spare key and other conditions in your home. This information was recorded on a 3x5 card stored in a small file cabinet, called the run card. The dispatcher would pull this card to notify responding vehicles about any special circumstances at your location. Today, most 911 systems can record information specific to your address and is typically called the premise page. A few systems still call it the run card, and here we're looking at a system that has both. I highly recommend that you register the location for your spare key with the 911 system. It could be a neighbor or some other location. On the website is this alternate key holder registration form that you can download and complete. It includes an area for you to record who you are, who this form is from, and 2 sections for alternate key holders. Call the non-emergency number at 911 and tell them about this information. Most will have the capability of recording that information. In some cases, they may want you to mail it in or stop by and drop it off. In addition to your alternate key holder, they can record gate codes, access codes, specific medical information for someone at this address, and hazards such as fuel, ammunition, and explosives in case of fire. Also, be sure to identify if someone at this location has a life support device, such as an oxygen generator. It's best to list the conditions. This print I realize is too small to read, but the list is included in the checklist that you can download from the website. And the symptoms that go with these conditions. This helps to better prepare the responders prior to entering your home. It's good to know if someone has a fear of being touched or maybe a flight risk, etc. It's a good idea to provide your alternate key holder with information about how to contact you when you're gone and in any special conditions regarding your home. On the website, you can download this form fill document titled Information for Your Alternate Key Holder. It's very important to inform your alternate key holder how you can be contacted when you're gone, such issues as fire, emergency, break-ins, or other structural issues. You may already know this, but many businesses provide a device called a Knox box, which is a secure box only accessible by the fire department and contains entry keys or other items necessary to enter a locked facility. Please make certain when the keys to your facility are updated or changed that you call the fire department and have them place new keys inside the Knox box. I've personally seen several instances where the keys in the Knox box are out of date and a forced entry was required. Here is something not well understood that can cause significant delays in the emergency response. Most people respond well when they hear sirens and lights and pull to the right-hand curb or as far right as possible. However, there are several situations where that action could be inappropriate, and here are a few examples. Naturally, we are inclined to pull the right-hand side of the road and stop as shown here. However, in this situation, the emergency vehicle is forced to enter a blind curve straight into oncoming traffic, which typically they will not do. In this situation, keep moving until you find a location where you can stop and the emergency vehicle can decide to pass. In similar manner, it may not seem logical to keep moving when you're going up or down a steep hill on a narrow road. If there's oncoming traffic and you stop on the uphill side, so will the emergency vehicle. And it can be a challenge to get going again, particularly for a 40,000-pound fire truck. Also, stopping on the downhill side can cause problems. If there's no room for you to pull over on a narrow road on the downhill side and there's oncoming traffic, the emergency vehicle must stop behind you. As I mentioned, the typical fire engine weighs at least 40,000 pounds and it has excellent brakes, but trying to stop going downhill can be a challenge. So please give careful consideration whether the emergency vehicle can pass your vehicle or must come to a complete stop. If not, keep moving until you find the location where they can decide to pass. And obviously, do not stop at the crest of a hill. I have personally been in emergency vehicles in this situation when a vehicle is stopped exactly at the crest of a hill on a narrow road, forcing the emergency vehicle into oncoming traffic, which they're not going to do. Instead, move ahead until the emergency vehicle has a clear view of the road and they can decide to pass. Here's a situation you may not have considered. We are looking from the emergency vehicle as it pulls into oncoming traffic. Most vehicles have pulled to the right-hand side and are stopped or stopping. We know that because of the illuminated brake lights. However, look closely, and you will see two cars with no brake lights. This can cause uncertainty in the emergency vehicle because it's not clear if they've heard the sirens or seen the lights. So after you've pulled to the right-hand side, please keep a foot on the brake so the emergency vehicle knows you are stopped or in the process of stopping. Unknowingly, vehicles will pull in front of an emergency vehicle simply because they did not hear the sirens or see the lights, particularly now that cars are more soundproof. Here's an important subject likely never considered by many of us: fire hydrants. Why do I mention fire hydrants? Why do I have to concern myself or think about fire hydrants? You might say, isn't that the responsibility of the waterworks or the fire department? Well, yes it is. And in normal staffing conditions, either the waterworks or the fire department will typically maintain the functionality of fire hydrants. However, because of staffing shortages, maintenance may get delayed and sometimes not done at all. I highly recommend that you locate your closest fire hydrant and your backup fire hydrant. Do they have clear visibility from both directions of travel as the vehicle approaches? Are there signs that the hydrant has been recently maintained? Here's an example where we have chipped and faded paint with missing fittings, so it's likely this hydrant has not been maintained. Hydrants need to be flushed on a regular schedule and the fittings greased for easy removal. Using the address example we used earlier in the presentation, the yellow arrow points to the responding address. The pink arrow points to the red dot, which is the fire hydrant that just happens to be across from the responding location. The two backup fire hydrants are shown by these yellow arrows. Typically, a fire department will know the location for the primary and backup hydrants, but they may not have been used or recently maintained. This is our home, it's our office. It can be us that suffer the consequences from a hydrant not working properly. So it's in our best interest to investigate this. There can be numerous situations where the hydrant has not been maintained and is completely hidden. I've seen many. If you don't know the location, please learn the location for your primary and your backup hydrants. If you locate a hydrant and learn it's been hidden or partially hidden, please call the fire department and report the issue. It's your home, it's your business that's at risk here, and also be diligent to determine if you have a well-maintained and working fire hydrant. Typically, requirements ask for clear visibility in both directions of travel with a 3-foot clearance around the hydrant, as illustrated here. If you find this is not the case for your hydrants, please report the condition to the fire department. They will determine if it's an issue they or the waterworks can resolve. And also, please do not take this matter into your own hands and start cutting down vegetation on other people's property. Here are pictures of a controlled burn at the fire academy that you may have seen before. It illustrates the speed at which fire can propagate. Typically, a residential fire can double in size about every 30 seconds depending on oxygen supply, fuel supply, humidity, heat, and containment. When you do the math, a 2-minute delay in response could mean the fire is 16 times larger. I show this picture for obvious reasons. It's very important that the fire department quickly locate a working hydrant on arrival of a structure fire. However, the rules can change considerably for private property. Depending on your jurisdiction, many hydrants on private property are not the responsibility of the fire hydrant. They may never have been flushed. Maybe the hydrant cannot flow water, which can cause enormous delays when needed most. I've seen this happen on numerous occasions in apartments and condo complexes. If your home or business is on a private street not maintained by the local jurisdiction, please find out who maintains the hydrant. Call the fire department. They'll typically know that answer. When there are no municipal fire hydrants, the fire department will use local rivers, streams, ponds, reservoirs, and yes, even swimming pools to shuttle water to the fire ground. And here are some typical examples for what they call a dry hydrant. On the fire ground, the pumper then will take its water from what they call a drop tank in a picture like this. Yes, dry hydrants do get clogged and do need to be backwashed. You may see something like this where they're using a bilge pump for backwashing. So if you're uncertain and have questions, please call and ask the fire department if these have been maintained. If you spot a dry hydrant hidden by vegetation, also be sure to report it. They want to know about it. Hydrants can malfunction for many reasons and then be taken out of service for repair. When you see an out-of-service hydrant, please keep track to see if it gets repaired. Occasionally they are inadvertently forgotten about, or with short staffing, sometimes the repair is delayed. So be diligent, call and ask about the repair schedule. Hydrants are more complicated than they look, and some of the components can malfunction, particularly when not well maintained. Hydrants need to be flushed, the fittings cleaned and lubricated, and painted, often with reflective paint for nighttime visibility. Also, I do want to mention that fire departments recommend that you always predetermine 2 ways out of a room in case of fire. With just one exit door, a second exit might be the window, which could be a challenge in some situations. I give my wife lots of credit for practicing this. She learned firsthand the issues and difficulty of trying to climb out a small window and climb down an emergency ladder. So please give this some thought as to the best solution for your situation. I want to pass along one of the top concerns from the 911 call centers. One of the top concerns from 911 call takers are that people do not call soon enough. Consequently, the situation continues to deteriorate and eventually becomes an elevated emergency. Often people will say, I didn't want to bother 911, or I didn't think it was serious enough. The call center highly recommends that you pick up the phone, dial 911 when you have a concern or a situation that could quickly become serious. If you don't want to call 911, then call the 911 non-emergency number. They do this every day, all day, and they are highly qualified to determine what is and is not an emergency. I highly recommend call, let them decide. They know. When you're not sure about any emergency issue or have questions, feel free to call the non-emergency number at the 911 center and ask. Here are a few of the reasons to use a non-emergency number in addition to your other questions. Stolen bicycles, vehicle break-ins, noise complaints. Keep the non-emergency number handy. They highly prefer to answer your question or concern in advance of emergency. Many are not aware of this, but most 911 operating centers will dispatch for upwards of 40 to 60 different agencies. So when in doubt, call a non-emergency number. Also, feel free to call your local fire department or police department when you have a concern or question. They will happily answer your questions. Here's how you can call 911 in a special circumstance. Find out if you have text to 911 in your community. You already may know this, but if you don't, please inquire. It's where you can use a cell phone to text the 911 center. This is particularly important for people that are hearing impaired, speech impaired, experiencing domestic violence, or an active shooter or active aggressor situation. When you cannot call, text your emergency to 911. They will respond via text, but don't delay notifying them. If you can't call with a phone, use a text. Here's an issue that may surprise you and happens often. So what's going on in this picture? Why all the emergency vehicles? Why are there 3 fire trucks, an ambulance, and a supervisor? Moving or lifting patients is one of the top causes for back injuries to responders and represents a significant risk. The collection of emergency vehicles is because of the high number of people required to lift and move the patient from the scene into the ambulance. If the responders do not know the weight of the patient in advance of their arrival, then they must call for additional personnel, which can take considerable time to arrive on scene. On many occasions, I have personally seen a 5-minute or more delay. I highly recommend that you always volunteer the patient's weight to the 911 call taker. Some call takers will ask, but when they do not, please volunteer the weight, even if the person's only 100 pounds. Responders want to know in advance to prevent the unnecessary delays. Also, always volunteer if there are stairs involved. Will responders need to move the patient upstairs or downstairs, which could require extra personnel? They do have special equipment for stairs, but extra people may also be required. So if you're not asked, please volunteer the patient's weight and if there are stairs involved. Let's discuss another emergency delaying issue. Shutoff valves. How many times has this happened to you? A malfunction has caused the water to flow uncontrollably, causing considerable damage. Sometimes we know where the shutoff valve is, and other times it's not so obvious. People often call the fire department for help, but this help is several minutes away and considerable damage can continue. So, learn where your shutoff valves for gas, water, and electric are located. Here's a good example. We're looking at the main shutoff valve for the entire house. I'm curious if you can see it. This was a call to the fire department because water was running from the upstairs bathroom and no one could find the shutoff valve. Still can't see it? Well, neither could the 4 responders. In the meantime, considerable damage continued to occur. Eventually, the water line was traced from the road to the side of the house where it entered, but it was not visible inside the basement. The homeowner had the basement remodeled and the contractor drywalled over all of the plumbing, including the main shutoff valve. So after chopping through the wall, the shutoff valve is located, and this is the way it looks today. On the website are ready-made signs that you can download and use for various shutoffs throughout your home and business. They'll print on just standard 8.5 by 11 paper. Even if you know the location of the shutoff valves, does the babysitter know, or other guests in your home that are staying for an extended period of time? Do they know the location? An emergency can happen anytime, anywhere, and the babysitter may be on duty, and a lot of damage can be minimized if they know where the shutoff valves are located. I probably was the only one in the neighborhood that gave the babysitter a tour of the house, pointing out the location for the shutoff valves. As we finish, you should now have a better understanding of how we, the public, can cause unintentional delays and how easily these issues can be eliminated or minimized. As mentioned earlier, here's a checklist that you can download from the website as a reminder of what to look for. And the button is on the home page here at the bottom. Thanks for attending the training, and now you know how to become the best 911 partner. Again, please tell your friends what you've learned here. The responders will greatly appreciate it. Also, I have found that getting the kids and grandkids involved in implementing some of these ideas work really well, and they learn something. I have seen it be very successful. So now, more than ever, is a good time to partner up with 911 and contribute to an enhanced outcome.